for her services to housing, and has held a number of government positions in select committees and was a panelist on the Letwin Committee. We'll then move on to Jennifer Winter, who's the head of benefits and housing needs at the London Borough of Hackney. She's been there for 6 years, more than 6 years, and is a member of the DWP Local Authority Steering Group and MHCLG's Technical Working Group. And then finally followed by Steve Douglas, who is CBE and Chief Executive of St Mungo's. He's more than 25 years of experience in the housing sector and has been also the Chief Executive of the Housing Corporation. So I'm going to pass over as we go to Christine and let her kick off the event. At the end, we'll have time for a series of questions. Please do feel free to put those in the chat.
Okay. I'm just going to give you a bit of background, and I do realize that many of the people who are listening, looking today, will already know all of this, but there will be others who are bemused by the titles that we use and all sorts of other things. So going back to 1977, it's a very long while ago, Homelessness Act in 1977 gave local authorities the duty to provide accommodation available to certain categories of priority need, mainly families with children and vulnerable adults, not usually single people if they didn't have additional problems. Now, we were ahead of the world at that point, and it was a major, major change. At the present time, that element of homelessness works in much the same way. Households have to be eligible for assistance, which means they have to not be no recourse to public funds. They need to be unintentionally homeless, and they need to be in priority need. Since the Homelessness Reduction Act of 2017, which is the biggest change since 1977, we've had 2 additional duties: prevention, that is to say, people should be helped not to get into a homelessness state, and relief, which is to help people maintain or find other accommodation for themselves. Now, that's the statutory homeless group. The other group are what people who are sleeping rough. And here we've had many, many different interventions, some of which have been extremely successful. At one point, London was down to really quite small hundreds, quite different from now. And the objective now is there's a rough sleeping strategy, which says that we will stop rough sleeping by 2027. And those who are sleeping rough or at risk of sleeping rough may be helped. This aspect has traditionally mainly been implemented by charities rather than by local authorities, because local authorities don't only have the responsibility for families and the vulnerable. Now, on the statutory homelessness side, just looking at London, the end of 2020, nearly 100,000 households in England were statutorily homeless and were in temporary accommodation. Of that, nearly 2/3 were in London. So London is the core of the problem. Also, because of the tensions in the housing market, there are proportionately far more families in temporary accommodation in London than there are in other parts of the country. And single people, I think, therefore have had a difficult time. And in the pandemic, the total numbers went up by 8% in England, but only 3% in London in terms of single people being accommodated. London also has to house most people in private rented accommodation, sometimes nightly accommodation, and often out of borough. So how the problems are much greater, and the problems of dealing with it are near infinite. And the most important thing to realise in this is the reason the numbers are so high in London is because people have to stay in temporary accommodation so much longer. The numbers coming in are not that different from the rest of the country. The numbers who can get housed are very much different. So the pandemic has had problems about evictions, and we've had evictions suspended, and they are now coming back. But they will come back very, very slowly because the legal framework is not there to get people out however much you may want to. And so there are expectations that there will be significantly more statutory homeless people over the next year or maybe even 2 years, but I don't think that it'll come just next week. It'll be over a longish period. And a big question for London is, how is the private rented sector going to respond? Because London has lost population, has lost students and other people who use private rented accommodation. So it may be that there's some hope on that side. Moving to those who are rough sleeping, Everyone In was introduced in March 26, 2020. And I should say in this context that many countries use homeless as the equivalent of those who sleep rough. And in America, when they put everyone in, what they did was put everyone into what accommodation they could find, which was often shared and was very similar to the type of accommodation we were moving people out of into hotels when Everyone In was brought in. So the intention, it was public health, which made it easier to fund. And anybody who was going to have difficulty in self-isolating had to be safely accommodated. And mainly in London, it was done in hotels and in other en-suite accommodation, which means student hostels and other things of that sort, some student hostels. The numbers were expected initially, the government said, to be about 5,500. They said in a month's time that they'd done 90% of those who were actually sleeping rough were now no longer doing so. And by May 2020, we got 15,000 accommodated. And by now, we've got 37,000 plus people who have been through the Everyone In system in one way or another. 26,000 of those have moved on to settled accommodation and 11,000 are still in emergency accommodation. That's probably gone down a little bit now. The numbers are very difficult to interpret because people may have come forward 2 or 3 times. We know people have gone off and accommodated themselves and then found they cannot do so. In some parts of London, that can be up to 25, 30% of their numbers have actually been through the process, but have not formally had hotel accommodation. So there's an enormous issue around no recourse to public funds. There are major issues about support, and overall, homelessness and street homelessness are very much London-specific problems, although it occurs across the country. To some extent, during the pandemic, one would have to say, and one would say it loudly because people have worked so incredibly hard, that policies and implementation have been very successful as compared to other countries, very successful as compared to the past, or at least the immediate past. Local authorities and charities have learned an enormous amount about how to cope, and they will hope to bring this forward into the future. But those working in the field are extraordinarily tired. And we're starting to see the next round of problems, particularly in the family context because of evictions and other irregular problems of getting potentially or actually homeless. And that is Jennifer's area of concern, which is very much for statutory homeless, but also those who come forward for prevention duties. So I will hand over to Jennifer and Fanny will do some.
Thanks, Christine. Lovely. So my name's Jennifer Winter. I'm head of the Benefits and Housing Needs Service for Hackney Council. It's a combined service that processes and administers housing benefit to residents. We administer roughly about £275 million per annum to 38,000 residents, but we do that, albeit we do it legally, we do it as generously as we can as part of a homelessness prevention outlook. I also provide housing advice, homelessness prevention, as Christine said, provision of temporary accommodation to those that are homeless, and also allocate all the social housing for the borough, as well as providing rough sleeping services. So that's just a bit of background about what we do and how we do it. So next slide, please, Fanny. So this just gives you a bit of background on the borough and what we're working with. So we are in the midst of an unprecedented housing crisis. We have, up until yesterday, I think there was a report that came out in yesterday's Evening Standard, which showed that we've been usurped by Waltham Forest. So up until yesterday, Hackney had the privilege of having the highest and steepest property value increase, and therefore a massive increase in private sector rents. But we've now dropped to number 2, and that's been, the crown's been taken by Waltham Forest. It makes our life extremely difficult, and it makes life for our residents very limited and extremely difficult. We know that we have huge amounts of overcrowding within our borough, and we know that overcrowding leads to conflict, poor health, and poor educational attainment. So it's really important for us. We have on our housing register at the moment in excess of about 13,500 households who require rehousing. Contained within that is those that are homeless, statutorily homeless, and in temporary accommodation. And that figure is 3,500. So that is those people who are living in temporary accommodation in the borough, and that's the highest we've had in Hackney for over a decade. What we're seeing is that more and more households are approaching us for help. More and more of those people are in acute need. And what we're seeing is that roughly about 1/3 of all people that are coming to us with help have multiple and complex needs. And that is a real change that we've seen over probably the past couple of years. So here's some stats for you. Oh, Fanny, we've gone a bit fast. There you go. Here's some stats for you. That just shows what's been happening during COVID. So what you can see there is despite having a 52% increase since 2017-18 of people coming to see us, is that during COVID that started to slow down. So what we were seeing was that single people were still coming to see us, and in fact they were increasing, but families were staying put. Families were hunkering down during COVID. They were staying put in their properties. We did see a small amount of people presenting. We did see an increase in those fleeing domestic abuse and gang violence, needing temporary accommodation as a result. But overall, the new placements coming into temporary accommodation have been down. We're now starting to see that rise again to normal levels. You would think that means the number of households we'd have in TA would have reduced, but sadly not, because during COVID, particularly the first lockdown and even emerging from the first lockdown, what we saw was that basically the housing market and social housing providers completely ground to a halt. So normally the exit routes from temporary accommodation, which would be providing and helping residents to access private rented sector accommodation or social housing, dried up. And that was for a number of reasons around agents, managing agents and landlords not being able to conduct viewings of properties. Social housing providers didn't have the staff in place because people were at home or isolating. After the second lockdown, we found that those things had really righted themselves. Two things we didn't expect to see that happened was that some families in temporary accommodation decided that enough was enough and they were going to move out of London. I'm talking about very, very small numbers here, handfuls. So we did have some people who urgently wanted to leave London and move into the PRS, and we helped them to do so. And we set them up with private rented sector accommodation with 2-year tenancies at the local housing, London local housing allowance rate, and an offer of tenancy sustainment. We did also see, for a very small amount of landlords, a change in their mentality prompted by the change in the economy. So what we saw, again, small numbers, was that landlords previously were quite reluctant to take people on benefits. What we saw for a few of them was that they changed that, and they're actually more reluctant to take people that were in work because the work was fluctuating. They were going into furlough, they were being made redundant, there was more stops and starts to their income. So actually they were finding that people on benefits became more attractive because, albeit their income was lower, it was actually uninterrupted. So as you can imagine, we took as much advantage of that as we can. But what we're starting to see is still a significant increase in people approaching us for advice, and we know that will increase with the ending of the renters' protection. Fanny, please, next slide. So impact on our TA residents. So we have roughly in Hackney about 30 temporary accommodation hostels in borough. We lease or own about 50% of those, and the other 50% are run by private providers for us. What we saw was families either left and went to stay with friends or relatives for the period of the few lockdowns, or, as I said, they hunkered down. Now, albeit we have high specification purpose-built hostels, homeless hostels in Hackney, the size criteria is still very small. So most of our hostels have self-contained accommodation, but it is still effectively living in one room with your family, despite having your own kitchenette and your own bathroom. We provide free laundry and free Wi-Fi, which particularly during COVID has been particularly key for those residents, particularly with homeschooling. Residents were finding it very difficult. We stepped up the amount of floating support we were providing to our families in temporary accommodation, and our staff who man our hostels were far more visible. We actually had lots more health and safety assessments, lots more additional cleaning. Sadly, some of the things we had to do from a public health and safety point of view was close the laundries, the free laundries that we provide, due to the lack of natural ventilation in some of those rooms. And that made life quite difficult for those residents because they couldn't understand why they had to go and access a laundry outside and put themselves at risk of COVID. So it's taken a lot more time to assist our residents that are in temporary accommodation. And then to top it all, we had a cyber attack on Hackney, which you might have seen in the news, which has made life a little bit harder, but we still provide a full service to our tenants that are families that are in temporary accommodation. Next slide, please, Fanny. So here's some stats for you. This is how much Hackney spends on temporary accommodation per annum. You can see the increase, just over 7 million in 17-18 up to 9 million. And then last figures, 10 million. We're still doing the outturn from last year, but I'm sure it will come in more. Probably about a third of our temporary accommodation residents and families are housed in accommodation outside the borough. It's not what we'd want. It's not a conducive way of life for those families. It often means those families are getting up at the crack of dawn, travelling into school with their children because Hackney schools are good and they don't want to give up those school places, nor should they. And then working and then quite possibly travelling home. At one point before October, we were still reporting 80% of all our families in temporary accommodation were in work. So they were in work and they were still homeless due to the level of rents and the lack of affordable accommodation in the borough. So we're hoping, you know, there are a certain amount of things that we require. That's on the next slide, Fanny, because we anticipate a tsunami of homelessness approaching us at some point over the next 2 years, particularly due to the eviction protection ending. And we need a long-term funding approach from government, because what we get at the moment is very short-termist funding. Our funding is allocated to us on an annual basis, which makes long-term planning very, very difficult. We also have a huge issue with welfare in this borough, and actually the government increased the local housing allowance rate, but didn't increase the overall benefit cap calculation. So what we've found in borough is that we've had approximately 1,000 households that, as a result of COVID, now fall under the government's benefit cap restrictions, which means that their benefits are reduced, which actually means there's far more likelihood of them becoming homeless at some point in the future. And we also have no statutory funding for rough sleepers, and that is just allocated to us every year, and we need a long-term settlement around that. And then also we have an increase in borough with the amount of people who have no recourse to public funds, and that's increasing. I think the biggest worrying increase that we are starting to see peak over the last couple of months is the increase in people fleeing domestic abuse and gang violence, families this is. We have a pan-London scheme called Safer London, which is a reciprocal housing scheme for those that are in social housing. So those families don't have to give up their tenancy, but they can swap with other people elsewhere who are in the same situation in other London boroughs. That programme has completely silted up because demand far outstrips supply. And we're in a really worrying position where we have families who are fleeing violence, who are now in temporary accommodation, but really have the threat of having to give up their secure social tenancy because there's no other way for them to leave a borough. And that's probably the most pressing concern for us at the moment. But really what we need is a long-term funding settlement and some clarity really around the government's plans for tackling housing, homelessness and rough sleeping. And that's it from me.
Yeah.
Is that back to you or straight to Steve?
I think it's straight on to Steve, hopefully.
Great. So thank you. Thanks, Jennifer. Thank you, Catherine. So I think I've been asked to just talk a little bit about St Mungo's and then to pick up the whole issue of rough sleeping, as it's called, or as many are now describing it as, just to be absolutely clear, it is a person who is homeless, who is sleeping on the streets. By definition, it is rough. It is absolutely inhumane. Government has set out a commitment to end rough sleeping, to end that inhumane practice, and we as St Mungo's are actually committed to do anything that we can to support that ambition. 30 seconds on St Mungo's and then just some reflections, I think, on what we've seen over the last year or so. So St Mungo's is a homelessness charity. There are many homelessness charities that work across London and across the country, delivering advice and support and campaigning for an end to homelessness and an end to rough sleeping. We particularly, though, focus on delivering services. So working with Jennifer and her team, working with local authorities, working with other homelessness charities to provide services to those who are street homeless. And during the course of last year, we provided services to about 33,000 people. That's 3,500 people every night. And during the last year, during the pandemic, we provided services to an additional 4,000 people. And so there's a reality that even as we and other homelessness charities work really hard to ensure that people do not have to sleep on the streets, there continues to be a challenge around, and in a number of areas, around the things that will need to be done to prevent people from having to sleep on the streets. In London, which is a key area for us, we work across London and the South East, in Bristol, Brighton, Bournemouth, in Leicester as well. But London is very important for us because, as Christine described, it is one of the real hotspots for both homelessness and street homelessness. So for us, the work that we've been doing over the many years that we have been a charity include Pan-London services with the GLA, providing no second night out services. We're responsible for the North London Tenancy Sustainment Scheme, which supports circa 1,800 clients working across 15 London boroughs. We manage the Chain, which is the database on information around people who are rough sleeping on behalf of the GLA. With Homeless Link, we support the Street Link service, which is about ensuring that people who are on the streets can find access to advice and accommodation. And across London, we've got 17 outreach teams working across the capital, with many local authorities doing our utmost to support those local authorities to ensure that people aren't on the streets. So my reflections, and Christine, you referred to both the statutory and the non-statutory responsibilities of local authorities, and you also referred to the rough sleeping strategy of MHCLG. And I've been with St Mungo's for not quite a year now, but I arrived in July last year, and I've only until recently heard mention once again of the rough sleeping strategy that had been set up. But there is something about the attention that had been given to rough sleeping, having not been given attention to some time. But there was a question around whether actually the manifesto commitment that had been made could be delivered. And I arrived as our organisation and local authorities and homelessness charities and public health and doctors and nurses and volunteers were all out on the streets, bringing everyone in, providing food banks, providing advice and support, ensuring that they were getting the housing benefit that they needed and access to services. And I have heard it said, and I'll say it as well, the collaboration between those different agencies was unprecedented. And for everybody that I've spoken to, that sense of this is a public health crisis, we will ensure that people are safe, drove every single action of every single agency. And the Lancet did some research on the response and the difference that it made. And they confirmed that actually the response from all of those agencies saved lives, reduced the numbers of people that were at risk of death, mortality, reduced the number of hospital admissions as a result. So in terms of just the doing the very basic, I think there is huge credit to everybody that was involved during that period. But we talk about that period, and the worry that we have is that for some, we're now talking about transitioning out and transitioning from. But Jennifer, you've described the continued work that is happening in local authorities, in homelessness services, because there is a reality that the challenges haven't gone away. There is a reality that that unprecedented working and collaboration that we saw was actually in spite of the system rather than because of the system. It was because of key people who said, we will make this work, rather than a system that allowed and enabled it to work. So the challenge for us, and I think the challenge for us to end street homelessness, to end rough sleeping, is that we learn the lessons of the last year. We may go back and review the strategy that government set up in 2017 to see how it worked. But the reality, I think, is that the last year really gave momentum and really gave power to bring people in and to provide the support and advice, the accommodation that was needed. So I think there are three challenges that I would, in our reflections, would say need to be put in place to make this work. And there's an independent commission that we're now supporting, the Kerslake Commission, with Lord Bob Kerslake, with a whole host of different organisations across the country, local authorities, public health, National Health Service England, voluntary sector, housing associations, to look at what the solutions are. We'll wait to see what those recommendations are that come in due course. But for us, and we're still, by the way, managing 4 hotels, us, DePaul, Look Ahead are still, in a sense, delivering on emergency services, even as we talk about transitioning from whatever currently looks like to whatever the future will look like. Yesterday, there was a celebration of the work of all of the agencies, led by Robert Jenrick and Eddie Hughes. And Louise Casey, Dame Louise Casey, spoke a few words. And it was almost like a Star Wars moment, if I could describe it as such. So the Alec Guinness, I was there before, I saw it, it can be done, let the force be with you. And effectively, I don't regard myself as a Jedi, I regard the many volunteers, the many local authorities, the many organisations who have helped deliver. But to help them ensure they can deliver on the manifesto commitment, I think there are 3 things. Firstly, and in a sense, it takes us almost full circle, flow, prevention. We need to ensure that we prevent people from ending up homeless and then ending up on the streets. It's been proved it can be done. You can have a debate about exactly what the numbers were. If it's 90% last year, if it's 50% last year, that was achieved in 1 year. So stopping the flow has to be the next task, so that we don't end up in a few months' time, in a few years' time, back in the place that we are and were pre-pandemic. And that's about accommodation. That's also about the services that are required as well. Secondly, there is this issue of non-UK nationals. We've said it's a mess, and our view is it does need to be sorted. When you hear dog whistle politics, as we'll describe it, which doesn't enable a sensible conversation around people who may have settled status, about people who may have refugee status, about people who, for all sorts of reasons, aren't able to get through the system. And so we can have a sensible conversation about that. We won't tackle what is a significant issue. And then thirdly, and this is specific for London, and real credit, because what we saw during the pandemic was unprecedented collaboration. We saw local authorities stepping and working together, working with the GLA, working with us. Some structures have been put in place. There's a rough sleeping strategy group now, which is chaired by a Director of Housing on behalf of London councils. And it has providers, it has public health in the room at the same time. First, it was an emergency response. Now it's genuinely looking at strategy. And it should be commended for that. We've got the mayor who has responsibility for the strategy for homelessness and rough sleeping across London, has also got the responsibility for the health strategy for London. The joining up and the connecting between the two, and the joining up and connecting between delivery agents is absolutely essential. We believe that it can be ended. We believe that rough sleeping can be addressed. The commitment that was made at this celebration yesterday reconfirms that if the political will is there and the money that sits alongside it, then rough sleeping, the option of people having to sleep on the streets, can be ended within this Parliament. Thank you.
Back to Nancy.
Yes, I'd like to thank all of you for some really thought-provoking presentations there. We just want to let everyone know that if you've got some questions, please do put them in the chat and we can ask them for you. And yes, Christine.
No.
Was that
It was just a couple of questions I wanted to ask the other. We're real hard workers in this. One is, I think you're talking about coordination, both of you, in London in particular. When I talk to people in government, the question is there any coordination between the central government departments, between the Home Office, the Ministry of Housing, and the Ministry of Health, or rather Secretary of State for Health, but there are other parts of the central government which are involved. And the second thing, maybe sort of depressing and sort of not, many years ago, probably 15, we had a session between London and Paris in the ambassador's house in London, the French ambassador's house in London. At that time, probably is 15 years ago, at that time, London had very low RUPS, people sleeping on the streets. And the ambassador and his colleagues said that they were spending in Paris 10 times as much per person. And they had something like, at that point, it was a very specific point, they had roughly something under about 70,000. You know, they were completely out of control with vast quantities of money. So it's not money, it's people. Money is necessary, but it's not the answer.
Jennifer, do you want to go first?
15 years ago, I think I was just starting in Hackney, Christine. Very much, I think, looking at things like HMO licensing and things like that. Our numbers in Hackney, from memory, in temporary accommodation at that point in time, our goal, I think, was to get our numbers in temporary accommodation families down to 123.
Yes.
We did it. And it was, you know, the thought that happened then, you know, when I'm looking at now 3,500 families and increasing, it is really quite shocking. And for me, it is primarily the fact that local housing allowance rates and the benefit cap have very much driven this, whether it's for single people or for families. It's made living in London completely untenable and has really put people at risk of homelessness. Steve, do you want to come in there?
Yeah, no, so yeah, I'd agree. And I actually was having a conversation with somebody from Public Health England around a personalised service, and I think that what I took away from that, and from your comment, Christine, on the London-Paris example, is that, and particularly for single homeless people, it's actually understanding exactly what their needs are and having more personalised services. So one of the challenges in this, then I'll come on to your second point. So one of the things that we know, and we again found during the pandemic, was the ability to have Jenny's team and a GP in the same room at the same time, doing an assessment, talking through housing options, and then having a pathway through both the accommodation and the support that was needed, made such a difference, both in terms of speed of response and effectiveness of a response. And just being able to do that, to triage it, to have a hub where that type of activity happens, makes such a difference. And so going forward, doing more of that, I think, has to be the right way. And then, Christine, to your second point, which is that, but that requires government, across government, to actually not just think about homelessness and people who are homeless, who are sleeping on the streets, as an MHCLG issue. It's wider than that. And I think we were talking just before we started, one of the real nuggets that I took away from the event yesterday that was chaired by Robert Jenrick was a confirmation that there is a commitment to a cabinet level committee to look at rough sleeping. And that has to include public health. That must include the Ministry of Justice. That must include other departments that have got a responsibility and an interest in it. And if we get that and they actually do something real around understanding that homelessness is a DWP affordability accommodation issue, rough sleeping is a challenge around mental health, is a challenge for those who are being discharged from hospital, is a challenge for ex-offenders. If we have that and a coherent conversation around that with a strategy that just isn't MHCLG, then I think that, again, we could make the real difference. And you see that. And just to, I'm not going to name all of the local authorities that are brilliant at doing this, because there are so many in London. But having a combined housing and health board at a local level enables a very local strategy that is both housing and health in the same room again. That coming together of the GLA and London councils around the health and homelessness strategy for London is another example of the, actually, if you do it and join it up, you can see the health impacts, the homeless impacts, and you can make a real difference. So I was heartened yesterday, but it now needs to do stuff. It can't just be a cabinet committee that's set up to talk and then not to do.
Okay, terrific. We've got one question in the chat, and it's around collaboration and data. And they're talking about collaboration being an issue that is concerning given the power that homeless service providers have. And they're saying that there's been a significant data grab and an accumulation of copious amounts of client data that is shared amongst themselves, and clients aren't given access to their own data. And the question is really why the sector itself kind of sequesters itself behind this wall of knowledge, and that doesn't this actually bring up kind of secrecy and conflict within kind of the informed care that is implied by homelessness policy? I think I have that question right from the person who's asked it. If I don't, please give me a little bit more of a lead on that. But I think essentially this is about data collection on clients and clients not actually having access to the data itself.
So would you like me to come in there, Nancy?
That would be great.
So when we assist people with housing advice and homelessness prevention and relief duties, we get their consent to give us information. The data we collect is from the client themselves. We ask them to provide the evidence to support their applications, and we don't normally contact people unless they would give us explicit information or consent to do so. We don't normally contact people unless we're given consent to do so. So I don't really recognise that. All our residents are able to see any data that councils collect on them through a subject access request. That's a free service. Anyone can ask for that and receive a copy of all the data that particular services in the council have on them. And I think that's a statutory requirement that we all carry out.
Yeah, and just to add from our perspective, and I don't know the detail of this, but I just echoing Jennifer's point. So all public agencies, charities are still governed by GDPR. And so in terms of information that we can provide beyond an individual client, that's absolutely only with the consent of the client. In terms of information that is available to client, the expectation is that information should be available to the client as well. So I'd just to echo Jennifer's response.
Thank you. We have another question on kind of trends on rough sleeping. And the question is, do you have any data on the number of rough sleepers habitually visiting A&E departments? that are being referred to other agencies rather than returning them to the streets. So do we know if there's a continuity, I guess, of care?
Oh yeah. So I love talking about hospital discharge. So in City and Hackney, we've got a really, really strong model, and I'm so proud of it. So for a number of years now, we have one of our officers who's situated in the Homerton Hospital. We have 2 mental health social workers that are situated within my homelessness team and also work across the Homerton Hospital and the council. So that at the very point that people are going into hospital, whether it's into A&E departments or into the wards, from the minute they're in, we are planning for their discharge. We do not discharge people to the street. We don't do that. And we have huge commitment from our health partners not to do that. We also have Roots to Roots, who are a charity who work in there with us, and we also have a model that we were helped to set up with our integrated discharge team and Pathways, who are another homelessness charity, and it works really well. We have step down accommodation where people who are homeless that are ready to be discharged from hospital have somewhere to go for 6 weeks while we casework them and get them into something that is conducive to their recovery. What we used to find a few years ago was that quite often people would circulate in and out of mental health wards and with intermittent periods of rough sleeping and then into temporary accommodation, but they wouldn't be able to sustain that accommodation and they would go back onto the streets and then back into mental health wards. We've stopped that cycle. We've got a model that really works. We've got a model that when we put people in TA, we're forming and agreeing resilience plans with people so that they can say, this is what I look like when I'm unwell. And when I start to display this behaviour, this is who I want you to contact and this is what I want you to do, so that we can help sustain people stay in temporary accommodation whilst we look to find them something longer term. So I'm really chuffed. And as part of that, we are now recognising in London that there are pockets of really good practice around hospital discharge and rough sleeping and A&E visits, but equally there's nothing in some boroughs. And how do we get that continuity across London? And that's a brand new piece of work that we've started in the homelessness sector with our health colleagues and London councils to ensure that we get a consistent approach across London. Steve, I'm sure you probably know the figures off the top of your head, don't you?
I'm just looking to see if I've got the briefing on it. I don't, unfortunately. But it is, but just to say, the fact that A, is brilliant practice there, but also then there's the sharing across the rest of London. And I think that our ask is that we see more of that across London.
I mean, I think that's a really interesting, Christine, did you have your hand up? Sorry.
Sorry, I think I've got a problem here.
We can hear you.
Sorry, was just for very early on in the everyone in emergency, we had a lot of discussion with health people in the research group, which was set up, international research group, which was set up. And the health people felt that they weren't interacting well with the housing people. So it's enormously pleasing to know that this is happening now and it's across London. Because the first sentence of anything you write about London is there are these boroughs and they all do it differently.
Yep. Consistency is difficult. I mean, I would never ever want to repeat what we went through in the early days of the COVID pandemic. You know, the hospital discharge turnaround time was 2 hours. When you're trying to get people who have been very ill discharged from hospital and into a bed somewhere in the community within 2 hours, you know, I had my staff who were previously desk-based pushing residents up Mare Street in wheelchairs, into hotel rooms, you know, being helped by Age UK and other charities to ensure that we had the right people in those hotels, surrounding those people and bringing the care and support into them. Not something I'd ever want to repeat, but I'm proud to say I was part of it. And, you know, the hospital models that we can build across London now will build on that foundation. They'll be ever so strong.
I mean, I think it's really interesting because it's something that you had talked about a little bit before, about having kind of an understanding of the framework that you're in within a borough and being able to arrange and work to the very outsides of that framework to kind of deliver the service you need to deliver. And it strikes me that a lot of this depends upon, and I think this is something that Steve mentioned as well, the experience and longevity of the officers involved to know how that system works. And I just wondered, you know, how easy is that, therefore, to get transferred across boroughs? Because you have such different levels of experience in each one.
Good question. Having said that, homelessness sector in London is incredibly joined up. I say this all the time to my local politicians and to anyone that will listen. You don't work in homelessness for a wage. It's not a very nice job to have because there's so little you can give to people. You're trying to assist quite often people who are in real distress, who have suffered huge amounts of trauma, and you have very little in your toolbox to give them. So quite often, despite the differences between boroughs, there's so much that is common. And we are a really tightly knit group with lots of forums, lots of staff interaction across the boroughs. Lots of staff have moved around within the homeless sector across boroughs. So there's all those informal link-ups as well. And I mean, the service I run, all my staff are generic. I have very few specialist roles. So although you talked about experience and longevity, actually what is almost far more important is resilience. And that is the massive risk, is the resilience. You know, people who have been doing this for the last year, even if they came new to it in the last year, because at the beginning of the COVID pandemic, what we saw was actually quite a lot of our charities were staffed by EEA nationals who very quickly went home. So they suddenly had a lack of staff as well. So half my street outreach team disappeared overnight and went back to stay with their families abroad. So we suddenly had to find staff to go into those roles. So throughout the whole COVID pandemic, I've been moving staff around, about 200, moving them from role to role very quickly, getting them up to speed so that they can deliver. But actually, resilience and communication are the key.
Just to add to that, in terms of, and we'll see what, I'd just refer again to the rough sleeping strategy group that is London Councils, which is borough-led, that has the GLA as a core member of it, also has public health and some of the voluntary agencies as well. It's recognised, firstly, that takes you back to Christine's point, individual local authorities have got the homelessness responsibility. So firstly, you've got to recognise that. And then there is okay, so what does good practice look like across boroughs? And sub-regional frameworks have really, as just a bit of a structure, helped to do some sharing of what good practice looks like. I think the North London partnership is the one that has been going for over 15 years now and is widely regarded as a pretty effective partnership. And then at the strategy level, you've got the GLA, you've got London Councils, you've got Public Health England / London, who have got that strategic responsibility. And the bit around joining up the dots on that, if you can get that right, then you've got the strategy which is coordinated, and you've got the delivery that is coordinated, recognising the good practice that does happen between many boroughs.
Great. Thank you very much. And I know we're right on 5 minutes to go. So if anyone has any final very quick questions, or Christine, did you want to come in with any? Okay. I think what we will do, because I know, Steve, you've got to run to another event directly after, is I will thank all of you very much for the really lively and interesting discussion today. Such hugely important issues we're dealing with. For everyone else, we will be coming back hopefully in September with some new events. And I will thank you all very much for coming to the event, and again to our wonderful presenters for being here with us today. Thank you.
Thank you.
Thank you all.
Thanks. Bye now.
Bye.
Bye.